Hi, Dr. Sassy here from Sassy Surgical. What if my pouch has stretched after gastric bypass surgery? What does it mean? What should I do? Well, I'm going to try to lay out exactly how to think about it and what to do about it. And if you hang in there till the very end, I'm going to give you an excellent resource for where you can go to read in much more detail about this topic that's an important one. So if I had gastric bypass years ago, I feel like my pouch is stretched because why? Because I can eat a lot more. I feel like my meal size is bigger, my portion size is bigger, and it no longer gives me that same sense of restriction or fullness. And two is because I might be gaining pounds. And obviously that's super frustrating and that's not what we want because we know that's associated with worsened health and type 2 diabetes and all the things we were trying to avoid with the gastric bypass surgery originally. So, is it as important as I think it is? Well, the interesting thing is that when doctors and investigators go look at the gastric pouch itself, the strange thing is that in the vast majority of people who are gaining weight and who do feel like they can eat more, the pouch itself has actually not changed very much in size at all. In fact, in the huge majority of cases, you can't tell any difference at all compared to the way it looked 10 years ago. And how do we square that? How does that even make sense? One way to help think about that is that when our body adapts to surgery over time, think of it as though the body wants to make life a bit easier on you. And so the body adapts and it processes the food and it squeezes and propels and our peristalsis functions so that the food moves through more smoothly over time and it allows us to eat more. We call this whole process the accommodation effect of the stomach. And so over time, our stomach becomes more accommodating. I'll give you an example that might help this make sense. Back when I was in my training, back 25 plus years ago, when we would do gastrectomy procedures for people who had a stomach tumor or a big ulcer, as a junior person, I was sometimes sent in to counsel the patients about what to expect after removing all or almost all of their stomach, and they had a very small stomach pouch, or in some cases, no stomach at all. And what we were coached and taught to say based on the decades of evidence from general surgery and stomach surgery is that, Mr. Smith, you're going to have a little bit of a hard time in the beginning. You're going to have to eat small meals, and I want you to eat 6 small meals a day for a time. But let me tell you, the good news is that the body adapts and the stomach pouch becomes more accommodating over time. And eventually you're going to be able to eat regular meals or pretty close to regular meals. In fact, most of our long-term stomach patients who had a tumor removed and have a small stomach pouch, 10 years later they can eat a cheeseburger or most of it. Now back then we thought that was a good thing, but when the procedure is being done for metabolic surgery, for diabetes treatment and sleep apnea and hypertension and obesity, we don't want to be able to eat a cheeseburger 10 years later. But the body has its own ideas, and so that accommodative effect is what's taking place, and that's what makes us think that, oh, the pouch must be enlarged and we must have to go do something about it. But there are things that we can do about it, and so just because the pouch itself might not be 10 times bigger doesn't necessarily mean that there isn't a tactic or a strategy to go solve the problem and try to get the weight loss back in gear and get back to a healthier weight. It does start with looking at the pouch, and usually we do that with an x-ray study, but sometimes we do it with an endoscopy to look directly. And there are some evolving techniques to try to tighten the pouch. I myself was an early performer of some procedures done endoscopically to suture and try to tighten the gastric pouch. And we had moderate results. There continue to be published reports where that has some moderate results. The problem is that that's generally not covered by insurance, and so it's a bit expensive, and so I'm always a little bit reluctant to have people have to plunk out of their own pocket a lot of money for something that's not going to really be a home run. The reason it only has moderate results is because it doesn't really solve that accommodative effect of the stomach, and it doesn't do anything to really change the hormones, which are what regulate our biochemistry and what regulate our body weight and metabolism. So what other strategies might there be? Well, once we've examined the pouch, and 9 times out of 10 we find that it really isn't especially enlarged or different, we still have other cards to play. So we can of course talk about exercise, we can talk about diet, we can employ medications to help with appetite control and weight loss. But usually the best thing that we can do is to revise surgically what's been done before to try to make it more effective, and usually we do succeed in that. So revising the procedure that was done in the past usually paradoxically does not involve directly going to the pouch because that rarely results in the weight loss that we are looking for. But what most commonly is the most helpful is thinking of the whole person and thinking of the whole procedure that was done and attacking it holistically. The most effective treatment that's the least invasive, we're always looking for most effective, least invasive. In the case of gastric bypass surgery, is to revise the gastric bypass in a way that brings it up to 2020 standards and has the metabolic effects maximized. That often involves what's called distalization, or making the pancreaticoduodenal limb longer. That's a big mouthful, but it means that the Y of the Roux-en-Y was constructed years ago in a way that is not as optimal as it could be today in light of modern research. So in doing that, that can normally be done with a 45-minute procedure with a laparoscopy, so small band-aids, that's what I'm doing with my fingers here. Very safe, very low risks, but a big impact on jump-starting the weight loss and the metabolic effectiveness of the surgery. 9 times out of 10, we look right at the stomach pouch and there's really nothing to be done there because it looks pretty normal. But sometimes we can also boost its effectiveness by tightening it up as well if it has swollen or stretched. But keep in mind, most of the time it really hasn't. Okay, so I promised at the end of this that I would tell you a good resource so you could sort of read about this in a little bit more detail. There's a special report at a site that we created which is called revisionbariatric.com. So revisionbariatric.com. So if you feel like perhaps your pouch has stretched and you had gastric bypass years ago and you feel like you can eat more and you're gaining weight and you want to know what the solutions are, check out that special report and you can sort of read through the logic there and it'll kind of mirror what I've described here. The good news is that there is likely a solution that will really help you lose weight and get to a healthier place in life. The kind of strange paradox of it is that it often does not exactly focus on the pouch itself, although a good surgeon, a good revision experienced surgeon will examine that as a component of it. But you might find the solution actually is not quite directly at the pouch, but more at the overall holistic picture. I hope that's been helpful. I hope that answers this kind of conundrum of a question. And as always, I wish you the best of health.